In India, a country that continues to grapple with the devastating surge of the pandemic, with total infections passing the 18 million mark after recording another record-breaking number of 379,257 new cases. And with the Indian economy and pharmaceutical industry severely impacted, countries including Kenya, which depend on India for pharmaceutical supplies, are beginning to look towards local production to meet their demands. Here in Kenya, 495 more people tested positive for COVID-19 in the last 24 hours. And as Dorcas Wangira reports, Uganda has confirmed one case of the India variant.
If a face could show the resilience in the wake of the devastation, death and despair of COVID-19 in India, here it is. 39-year-old Manika Goel, a software engineer, sits in a hospital ward where her husband Amit is being treated for COVID-19. Her mother, father and sister also tested positive for COVID-19, but her mother died this morning because of lack of a ventilator. Her father also needs ventilator support.
Doctor says we have 2 days.
The doctor says we have 2 days. I have tried. I don't know. Thousands of numbers across India. Nobody is helping. If we can save even one life, that will matter to me. I am not ready to take the second blow. I could not even cry. I don't know what I should do. I am helpless. I am educated. I am an engineer. I am working with the topmost company of the world and I can't do anything.
Thursday, India tallied 379,257 new cases of COVID-19, another record-breaking number which cumulatively pushed new infections past the 18 million mark and 3,645 new deaths. Gravediggers continue to work around the clock to bury victims, and hundreds more are still being cremated in makeshift pyres in parks and parking lots. Hospital beds that become available, especially in intensive care units, are snapped up in minutes. Global aid is coming in to assist the world's second most populous nation. India is set to receive a large chunk of the 60 million doses of the AstraZeneca vaccine, which the United States intends to share globally. India's pharmaceutical industry, whose capacity to import raw materials, manufacture and export pharmaceutical medicines, has been severely impacted by the surge of COVID-19 infections. The state of its pharmaceutical industry, global health experts say, will also determine the impact of the pandemic on 1/5 of the world's population who depend on India for critical medical supplies, including vaccines. Kenya, which also relies on India for pharmaceutical supplies, is also beginning to look inward. Speaking after touring the Revital Healthcare EPZ factory in Kilifi County, which manufactures healthcare items including syringes and surgical masks, Health CS Mutai Kagwe says Kenya, which imports 70% of pharmaceutical requirements including vaccines and other biological products, will have to prioritize procuring 40% of medical products from local suppliers.
Kenya is in a strategic position in the region to become a manufacturing powerhouse of medical commodities, and it is upon us, government and the private sectors, to engage in impactful public-private partnerships.
In the last 24 hours, 495 people have tested positive for COVID-19 from a sample size of 4,929, with a test positivity rate of 10%. 19 deaths were recorded, 6 being late death reports, and 13 having occurred on diverse dates in the last 1 month, tallying the fatalities to 2,707. 1,250 patients are admitted in various hospitals, with 191 being in the ICU. 865,897 people have been vaccinated so far. Dorcas Wangira, Citizen TV, Nairobi.